Right, I want to bring in Dr. Jean Kaseya, the Director General at the Africa Centers for Disease Control and Prevention. Dr. Kaseya, thank you so much for taking the time. And it's a critical moment. I know how PEPFAR sort of changed the fight against HIV/AIDS from where I come from in South Africa. It affects many African countries. You've got the suspension of US aid for 90 days. And in his executive order, President Trump claimed that US foreign aid and bureaucracy isn't aligned with American interests and American values. Tell me why it is important for America to fund these kind of programs, specifically PEPFAR and generally anything to do with the medical industry.
Thank you so much for having me, Eleni. Let me start by saying that in Africa, we are grateful for the support that we are getting from the US government, mostly in the health area that I'm leading in the continent. Just if we need to give an idea, in 2024, we got $8 billion of support from the US to African continent, and 73% went to the health sector. It means today the US is the main partner that we have bilaterally and also multilaterally through a number of organs and organizations. What we see as a trend today in Africa, it's not just the pause from the US government, but it's also the reduction from assistance from other Western countries. And that one is a major threat to not only Africa, but to the world. And as Africa CDC is projecting with this trend to have around 2 to 4 million additional deaths annually. And that one will also increase the likelihood occurrence of pandemics. This is why we think that we need to continue.
So Dr. Kaseya, Dr. Kaseya, I want to talk about the Mpox breakouts. I want to talk about the Marburg virus. And if there isn't funding to try and ensure that these breakouts don't spread, what that means for the rest of the world and for America in particular.
When I declared Mpox public health emergency of continental security in Africa in August 2024, we had only 6 countries. Today, we have 21 countries affected. And out of $1 billion pledged by partners, including $520 million from the US, we only got 47% of this money. Without funding, this Mpox that is affecting almost around 45% of African countries will continue to spread. Don't forget that Mpox in 2021 affected the US, Europe, and other continents. There is a huge risk if we don't get this funding pledged by Western countries that Mpox can even become a next pandemic.